Good evening, friends. I am Dr. Pranav Shah. I am the Director of Orthopedic Trauma at SIMS Hospital. And today I am going to share a little bit of knowledge about how we will be conducting orthopedic surgeries in the times of coronavirus and COVID. All of you know that this has become a big health challenge for all of us. We want to get back to routine normal, but we don't know what protocols we should follow, how we can maintain safety for ourselves and our patients. I hope this talk clears a few doubts in your minds. So first, let us talk about this coronavirus, the SARS-CoV-2. This is the virus which is causing the COVID disease. It is having a tremendous amount of infectivity and it has created a havoc all over the world. For us, it is good enough to know what kills and what does not for this virus. So we all know it is a heat sensitive virus, so autoclaving can get rid of it. It is also sensitive to ultraviolet rays, so it is presumed that 2 to 3 hours of exposure to direct sunlight also will neutralize the virus. Ethanol or any alcohol containing disinfectant with 70% or more concentration will be able to disinfect the surfaces for this virus. The virus is also sensitive to hypochlorite, that is chlorine containing disinfectants. And the best thing is it is sensitive to soap. So for a human skin disinfection, the least toxic method of disinfection would be using soap and water. But let us all bear in mind that chlorhexidine or lesser concentrations of alcohol or povidone iodine like betadine do not have much effect on this SARS-CoV-2 virus. A little bit about pathophysiology, because it is evolving, studies are coming up. Initially we thought that it is just the virus which is lethal. Now we know that it is the immune response to the virus, which they call as the cytokine storm. That is the lethal part of coronavirus disease, that is COVID. We all know that the transmission is by infected droplets, that is a respiratory transmission, and a fomite based transmission, which means that if the droplets are lying down on any of the objects and we touch those objects, and with that object we touch our face or our nose or our mouth or our eyes, then that can cause infection to us. What is important to understand, there is no cure, no vaccine, and up to 10% mortality. So it is very important for us to bear this in mind. Now we all know that there is a high risk population, people who will be more affected adversely with the coronavirus disease, and the first being the elderly people. People with the age of 60 years or above, they have shown higher morbidity and mortality and infectivity with coronavirus. People who are diabetic, people who are chronic smokers or having some interstitial lung disease, people who are immunocompromised because of chronic liver or kidney disease, they are also at a high risk for getting the COVID and COVID complications. What is important to note is that a healthy healthcare worker with no such pre-existing disease or compromise also is at higher risk, because we get a higher viral load. The exposure that we get through a patient and the amount of droplets that we inhale because of a patient is much higher. So that higher viral load makes all of us more vulnerable to the COVID disease. Obviously, people with cardiorespiratory illness, doctors with cardiorespiratory illness are at a still higher risk. So we have to understand that we have to take all the precautions for our own safety first, our staff safety first, and then our patient care. We need to modify our practice in the times of COVID-19 because we want to save ourselves, our staff, our patient, and most important, our family. None of us want to go back home with the infection and infect our own family. So how we will do the care? I have divided the talk in 4 parts. How we will care in the OPD, what care we will take with the indoor patient, what precautions we will take in the OT, and how the surgery selection or triage should be done so that we do only the most important and most necessary surgeries and we avoid the surgeries which can be postponed. So OPD care. First of all, let us understand that the time for telemedicine has come. If you can, and if you can talk to your patient on the telemedicine portal, if you can counsel the patient, if you can do follow-up of your patient on telemedicine, then that is most preferable way of providing OPD care. The second method would be to have a very stringent appointment system so that you don't have a crowding in your OPD. You should not allow more than one relative to come in the OPD. All the people who come to your OPD should be wearing a surgical mask. there has to be a registration or screening area where certain questions will be asked to the patient. Their address proof can be checked. You should find out whether they come from a hotspot area. You should make sure that they are not carriers. They may not be having the symptoms. Beware, patients may hide information and we have to be prepared for that. Also in the OPD area, try to minimize the movement. So if you have a cross reference, if you can get the talk with your colleague on phone and give advice to the patient without sending the patient over there, it's better. It's also better if the patient stays in one area and different doctors consult the patient in the same area. This is the way we can minimize movement and minimize infection. And most important thing is social distancing. So your seating area in your consulting area should allow 1.5 meters of distance between two people sitting in your waiting area. All this care we have to take in OPD as well as in indoor patients. Now surgeries. What orthopedic surgeries will you do and what surgeries you will avoid? So as a guideline from the Indian Orthopaedic Association and from various orthopedic associations world over, they have said that elective surgeries should be postponed till better guidelines and better treatment therapies are available. So probably another 4 to 6 weeks, we should avoid doing joint replacements or arthroscopic surgeries or deformity correction, degenerative spine surgeries. We may even avoid doing closed fracture treatment, which can be treated conservatively. But there are some situations where we may have to operate. That is displaced fractures of the lower limb, hip fractures, infections, spine surgeries with neurological deficit, multi-ligament injuries, which may create a lot of morbidity later on, and orthopedic tumors, which are in the neoadjuvant phase, which means that a chemoradiation session has been done. Now the time has come to operate and it will be followed up by again chemoradiation. So these are the patients who cannot wait and we have to go ahead. Then there are the absolute indications where you may even do the surgery without a preoperative COVID test or without a lot of preoperative workup. And these are the open fractures, the fractures with neurovascular injuries, polytrauma, crush injuries, compartment syndrome, gangrene, cauda equina syndrome, or acute and severe sepsis. One of the examples is also of a reimplantation. Some police guy in Punjab had reimplantation surgery done during the COVID times. So these are the absolute indications where surgery has to be done. And if the surgery has to be done, then the proper precautions have to be taken. So first, start with the investigations. It is better to over-investigate. So do a very thorough preoperative investigation. All routine preoperative tests, detailed history about the patient travel and COVID hotspot, look at his Arogya Setu app, whether he is a high-risk person or not. Every patient is posted for invasive surgery has to be ideally tested for COVID-19. And you can have such protocol in your institute and follow it. Chest X-ray and CT scan also are other screening methods, but they are sensitive in the 40 to 60% range. The COVID test is sensitive to 60 to 80% range. So there will be false negative reports and it is better to take precaution as if they are COVID positive. Before we go into the details of orthopedic surgeries, let us understand what is this AGP. AGPs are the aerosol generating procedures. These are the procedures where droplets will be formed which can contain the virus and which can infect everybody in the operation theater. So most orthopedic surgeries are AGP procedures because we use lot of power tools, pulse lavage, cautery, all these create AGPs and they have a higher risk of virus transmission. So let us treat all orthopedic surgeries as high risk surgeries unless it is a close reduction of a fracture or some procedure like incision and drainage. All these patients who are going to undergo the high risk surgeries, it is necessary for us to have the adequate PPEs for ourselves and for our staff. There are something called the powered air purifying respirators, the PAPRs, which are now available, which purify the air before it comes to us. So these are the PAPRs. It is marketed by the 3M company. I don't think it is available anywhere in India for an operative setup. And this should not be mistaken for the surgical hoods or the surgical helmets that we are using. Those are very different from PAPR. On the contrary, surgical helmet or hoods are not to be used as per the guidelines from orthopedic surgeons. What you can use is a face shield or a mask with a face shield, which will help you to prevent a lot of droplet contamination on yourself. This N95 mask is something which everybody is running after, but most of the times we are not getting the correct N95 mask. The N95 mask has been designed so that it seals completely, and whatever breathing or whatever air exchange occurs is from this filter. Now, most of the N95 masks that we have today are like this, which is only written N95, there is no filter. So I don't think this is the ideal N95 mask. But since these N95 masks are only available in the government setup, we have to do whatever we can through these ones. What is important to understand is this cannot be shared. It is not to be reused ideally, but we have certain protocols where you can use a set of 4 N95 masks, repeat the use of each on the 4th day, and put it in a plastic or a paper bag till 3 days so that you can reuse it. Each N95 mask ideally can be used for 100 hours. So that is all about the N95 mask. Ideal full PPE in a confirmed COVID positive patient should have all these things. This is even more than the hazmat suit, and most of the times a PAPR device is to be used along. But since most of us are not going to operate a COVID positive patient, we may be happy with this kind of a PPE kit. So an ideal PPE kit should contain an N95 mask, this kind of an impervious hazmat suit, eye goggles or face shields, double set of gloves, and they call it the nitrile gloves, and the shoe covers, impervious. So this entire set is at least a basic requirement if you want to conduct an orthopedic surgery in these times. What other things? This should be available to all the personnel in the OT, whether the person is scrubbed or not scrubbed, because our procedures are going to create the aerosol generation. And that is why everybody in the OT, the surgeon, assistant, anesthetist, everybody should use it. Now, what OT protocols we will follow? So we should have a dedicated OT for COVID positive or suspected patient. Other than that, all other OTs can be used for confirmed COVID negative or minimal suspected COVID negative patients. Don't use the laminar airflow. If possible, try to change the setting of your OT into a negative pressure OT so that air is sucked in and pumped out rather than the other way, which happens in the laminar airflow. Keep the doors closed during the procedure, have minimum people inside the OT, and minimize the entry and exit because it creates currents, and these currents, air currents, can create spread of the aerosols. Deep cleaning to be done after every procedure and daily fumigation to be done in the OT. These are at least basic needs if you want to operate safely. Now, pre-operative care. There are certain equipment and certain methods you can use to minimize the aerosol generation. And first thing being minimize the bleeding. So using a tourniquet, using tranexamic acid, having a good surgery with hemostasis. These will be definitely very helpful. Minimize the use of cautery and try to suck all the cautery smoke as best as you can. There are some smoke evacuators available, and they are also available attached to a cautery pencil like this. So if possible, try to use this kind of a cautery, or you use a smoke evacuator like this so that the aerosol generated contamination is minimized. Avoid pulse lavage or high pressure lavage. Minimize the use of power tools. So if you can use if you can use an osteotome, minimize the use of saw. Minimize the use of drill, minimize the use of reamers. Try to do close reaming as far as possible. Use a hand reamer instead. Good hemostasis before closure and closure with absorbable sutures is advised by most of the associations, because you don't want some of your staff to be very close to the patient when the stitch removal is done. The post-operative care, first start with the dressing. Avoid bulky dressing. You have had a good hemostasis, so you don't need a bulky dressing. Try to use a waterproof transparent dressing like this. So without opening the dressing, you can have a look at the wound from a distance and you are not in a close contact with the patient. Suppose the patient requires some splint or some slab, then try to use splints rather than plasters, because when the plaster needs to be removed, the healthcare worker is in very close contact for a long time with the patient. Try to minimize the hospital stay. Follow-up can be done with the help of telemedicine, and rehabilitation and physio should be done using educational videos and telemedicine. Try not to send your physiotherapist to the home of the patient. These are the basic minimum things that we can do to prevent the spread of COVID. Avoid stitch removal by using absorbable sutures, so that after 17 to 20 days, you can just remove the dressing, allow the patient to take bath and do whatever they want, and those sutures will get absorbed on their own. Donning and doffing of PPEs is a very specific sequence, and I would suggest everyone to see the online videos of how to wear the PPE and how to remove the PPE. Be careful, certain parts of the PPE are to be removed inside the OT. Only the mask and the first set of gloves has to be retained. This gloves and face shield and gown has to be removed first. Then you should wash your hand with alcohol or spirit, and then you can dispose all other PPEs in a designated biomedical waste containers which are provided in your hospital. Remove the mask outside and ideally take a bath before changing to your own clothes from the OT clothes. If you can take these precautions, then you have done your bit. The OT linen, biomedical waste and protocols for these are institute dependent. In our hospital, what we have done is the instruments are cleaned with hypochlorite solution and then as regular solution, as regular cleaning. The equipments are cleaned with either ethanol or hypochlorite based cleansers, equipment like IITV and OT table. Then soil linen is heated in 60 to 90 degrees water with detergent, soaked for 30 minutes, or you can clean it with a chlorine solution soakage, one of these two things, and then it can be washed. All linen should be dried in sunlight, and biomedical waste containers to be clearly marked as COVID, and ideally use 2 plastic bags so that the chances of perforation are less. So friends, these are all the things that you can do to conduct safe surgeries at your place. We are doing it for the last 1 month, and by grace of God, we have been very successful in doing safe orthopedic surgeries at SIMS Hospital. If there are any questions, I will take it now. Thank you.